Good afternoon, my name is James Jordan. I'm with the Montgomery Fire Rescue. Today we're going to be going over the Montgomery Fire Rescue skill checkoffs for BVM ventilation. BVM stands for bag valve mask. This is going to be done on a patient that is unresponsive and not breathing on their own. There's 12 steps to this procedure that you will do, and we'll go over them at this time. Okay, we're going to go over the equipment used today. We're going to have some gloves for BSI, some eye protection anytime you're doing ventilation. We're going to have a manual suction device. You can also have a battery powered. We're going to have a assortment of oral pharyngels. We'll come with a O2 equipped with a regulator to put out 12 liters per minute, and an adult bag valve mask with mask and reservoir and tubing. Going right into step one, we'll go with the scene safety. Scene safety on all scenes. You want to make sure you're safe. The scene's safe for all patients and fire and ambulance personnel. Once you determine the scene is safe, then you're going to go into BSI. Step two will be BSI, body substance isolation. We're going to choose between gloves. You can use eye protection if you deem necessary. Today we're just choosing to use gloves. Step three, check for responsiveness. Hey sir, can you hear me? No voice stimuli. Check for pain stimuli. Sternum rub. Sir, no response to pain. Patient is unresponsive at this time. Step four, check for breath. We're going to look, listen, feel. We're looking for rise and fall of the chest. We're feeling and we're checking for any inhalation movement. We have none at this time. Step five, check for a pulse. On a non-responsive patient, midline of the trachea, 2 fingers to the left or the right of it, check for a carotid pulse, no more than 10 seconds. Step six, open airway with the correct method. If you have a non-traumatic patient, you will be able to do a head tilt. If you do have a trauma patient, you will do a jaw thrust. At this time, this is a medical patient. We will not have to worry about C-spine at this time, so we will do a head tilt and open airway. Step seven, suction. Today we're going to be using a manual suction device. You want to make sure you remove the safety cap off the end. You want to make sure the lock is undone and it's able to operate in the right. You'll open airway, you will insert the suction device in, and then as you're in, you will pull the handle, which will cause the suction on the way out. You will hold the device away from anybody and release it. Step 8, we will insert the oral airway. At this time you will have a choice. You will pick the one that you need. You will go from the corner of the mouth to the corner of the ear. Once you have chose the size you need, you will insert the airway. You will have the curved end facing up to the roof of the mouth as you insert it. And as you're going back and you're passing the tongue, you will spin the oral device facing down until it's completely in. Step 9 is when you're going to start the ventilation. At this time you will get your bag valve out. You will make sure everything's there. You will turn the nose cone upwards, bridge of the nose, make your C and your E. You place your C on the top of the mask, making sure that it is over the nose and the mouth, pushing pressure down, using your jaw thrust, and you will do a series of ventilations without oxygen administered through the bag valve. 10 to 12 breaths per minute. Step 10, after administering 1 round of oxygen by ventilation mask, you'll reassess a pulse. Same, go midline of the trachea, left or the right, 2 fingers, and check for a carotid pulse no more than 10 seconds.
Step 11.
Step 11, this time you will start ventilation with oxygen. You will take your bag valve mask tubing, you will connect it to your oxygen regulator, making sure it's firmly on. You will turn your oxygen on all the way. Then you will turn the liters per minute up to 12 liters per minute, 10 to 12. You will fill your reservoir bag up. As you can tell, it's starting to fill. You'll then still do the C and E, placing over the bridge of the nose, covering the mouth and the nose. C on top, pressing down. Head tilt, chin lift, or jaw thrust. And then 10 to 12 per minute, using 10 to 12 liters per minute of oxygen. Step 12, smoothness of operation. The more you get out, put your hands on it, the more proficient in the use of the equipment you will be.